Today on Inside Utah Politics, the COVID-19 pandemic and underserved populations. Minority communities are being hit especially hard in our state, how state lawmakers are planning to address the disparity. Plus, the pandemic has turned family schedules upside down, leaving many with no option for childcare. A look at the federal effort to pump billions of dollars into making sure parents have somewhere to turn.
Time now for Inside Utah Politics.
Thanks so much for joining us. I'm Glenn Mills. It is time to go inside Utah politics, and we begin with State Senator Luz Escamilla. She's here to discuss a COVID-19 program for our minority communities. Senator, great to have you on the show. Thanks so much for being here.
Thank you, Glenn. It's always a pleasure.
Okay, so let's start off. You yourself tested positive for COVID-19. Talk about overcoming it and knowing that experience from firsthand perspective.
Yeah, I mean, it was March 16th when the symptoms started for me, and that was right after the session ended. And as you know, as someone that covers the session, we are very busy. We're doing 12, 14-hour days during the session, and after that, immediately this happened. So I certainly changed my personal perspective on the pandemic itself, but the virus and what families and individuals have to deal with as they're not only facing the disease itself, but contact tracing to stopping everything, isolation, and then quarantine. So I think it gave me a different perspective. I'm glad to say that I feel way better, back in working full time and in this new way of doing things. And just I think that perspective certainly gave me this motivation to start addressing the many communities that are suffering through this process and maybe getting disproportionately impacted at higher rates. So I joke aside that even in the legislature, the only one that's been tested positive from my colleagues has been me. So I even in there, I think certain communities are getting disproportionately impacted. So Latinos in the state of Utah is kind of like as a member of that community, I know there's many of those community members that are getting just COVID-19 positive cases more than any other groups.
Yeah, we'll get into more of that right now, but I just want to say we're glad that you're able to say you're feeling better as well. And when someone tests positive, I think it kind of hits us all. It gives us that perspective, wow, this is something we really need to be paying attention to. Let's get into more of that. Minority stats here in the state of Utah. Why are our minority communities being hit so much harder, and give us paint the picture for us of what that looks like?
Absolutely. We know from evidence that social determinants of health create health disparities. And obviously this COVID-19 pandemic, it's a public health crisis that we're facing. And it was going to happen that those communities were going to have to deal with those pieces and have disproportionately more barriers to overcome when it comes to any public health issue. What's very unique about this COVID-19, as you know, is that our essential workers, also by occupation, has become almost a hazard or has increased your possibilities of becoming positive through this process. So many of these members of these communities are part of our essential workers workforce. And I think the combination between the social determinants of health and being essential workers has, I think, now shown that they are disproportionately being impacted.
Yeah.
When you think about working families that are low income and are struggling, they may have a 1-bedroom, 1-bathroom apartment. And if you have one member of your family that's COVID-19 positive, how do you isolate under those circumstances? So the spread of the disease gets a little bit more challenging.
And to put this into perspective, 1/3 of the cases here in the state of Utah are among Hispanic and Latino populations, but they only make up 14% of the total population. So just think about that for a minute. Okay, now we have this response program. You and 5 other minority lawmakers have been working together on this. Give us the background. How did it all come together?
So this all started by, we started having conversations. Many of them were checking on me and how I was doing as I was trying to recover, going through this recovery process. My husband also tested positive. So for us, it was like a whole family journey. But in those conversations, we started seeing the gaps. I mean, communities were reaching to us as legislators, not only because we are part of those communities, but also because we represent those districts where you have heavy representation of these ethnic minority communities, our refugee community, our immigrant community. And we realized that the gaps were large and that there's nothing specific to address not only a testing piece of this conversation, but interventions that are data-driven and evidence-based. So what we put together was we start having conversations also with members of the members of leadership in both Republican and Democrats in the legislature, and we were able to secure funding in partnership with the executive branch. The governor's office was very instrumental in the Department of Health on putting a initiative that will be focusing on data-driven, evidence-based approaches so we can follow the hotspots where we see very high COVID-19 positive numbers and bring interventions with community health workers that are kind of like cultural brokers that could help us navigate communication with those communities, individuals that are positive so they can be better informed, educated, and be better when it comes to to comply with isolation and quarantine. That will definitely reduce our impact of spreading the disease. And of course, this only happens through testing. The only way we know if someone is positive is through testing. So that's the overview of how this legislators, Representative Romero, Representative Mark Wheatley, Representative Karen Kwan, Representative Sandra Hollins, Senator Iwamoto, and myself came together, and we decided, let's do something, let's bring partners together. So mentioned the state of Utah. Salt Lake County has been wonderful. Mayor Wilson, Salt Lake City, Mayor Mendenhall, and also University of Utah. Utah State Fair Park will be our first site, which is also one of our partners. And so we're doing multiple things, but more importantly is that we're going to have a process that will help us collect data so we know where the hotspots are with these communities, and we'll follow them.
Okay, so that first event was at the State Fair Park, as you mentioned, yesterday on Saturday.
Correct.
What will the schedule be like moving forward? Because that's just the first.
Correct.
Right?
This is more of like a kickoff. What you're going to see now is, as we are now contracting with the community-based organizations that have those relationships with those communities, our community health workers will start just making appointments and using the different sites with the University of Utah. But at the same time, we're going to use our wellness bus of the University of Utah here in Salt Lake County. Huntsman Cancer Institute will be our partner in Utah County, and we're going to be, through data, we're going to just go where those hotspots are and target those. It's going to be very targeted, and it's going to bring those community health workers to bring resources beyond just testing, Glenn.
Got it.
The key part is testing just gives you a positive or negative information. What happens after that is where we want to be providing interventions. So housing security, food security, and other resources will be part of this whole program.
And you'll be reaching out with dates and times in the future, and we can pass that along. Let's talk about this new multicultural subcommittee that the governor formed as part of the coronavirus task force. We have about a minute left. Is that also a very key element in addressing the impact of COVID-19 on our minority communities?
I think anything that raises the visibility of the fact that these communities are disproportionately impacted is positive. I applaud the governor for putting this as part of his agenda, and we welcome them to collaborate. We know them, most of them, and they're friends, many of them, so we will definitely be in communication. It's a little bit separate from what we're doing here. This has been very dry. The drive from here came from the legislature and those with our partners, and again, big thanks to the University of Utah, to the Department of Health, Office of Health Disparities, and Utah Fair Park for opening their doors, that it's a safe environment, that people feel safe in our community.
One last question for you, Senator, before we let you go. Are you satisfied with the level of minority input on this effort when we're trying to address this very problem with the minority community?
No. I think there's definitely not been enough representation, and that definitely, I think, can change the conversation. I hope more of our leaders take action. I want to say I applaud the state legislature, because many of my colleagues on, that are not members of those ethnic minority communities were very instrumental in helping us get the funding. And I want to say that I think in the legislature they've been very open in listening on this issue, and part of it is because one of their members became positive and happened to be a Latina. So I think that's been helpful. I think there's a need for more representation, Glenn, and that's something that needs to be addressed and needs to continue to raise that visibility, and I hope we get more of that representation in place.
Okay, well, we appreciate you sharing your perspective with us on this show, and thanks so much for being here.
Thank you.
Still to come, questions about the state's response to the COVID-19 pandemic and millions being spent on no-bid contracts. Our panel weighs in a little bit later. But first, some federal lawmakers say the coronavirus crisis has forced Medicare and Medicaid into catching up with the times, and they want to make that permanent. More on that bill after the break. Some members of Congress are hoping to negotiate a major increase in spending for childcare in the next coronavirus relief package. They argue every other sector of the economy depends on it. Washington correspondent Joe Khalil reports.
Congress approved $3.5 billion for childcare in the first CARES package. House Democrats are now asking for at least $50 billion in the next one.
The figure that was in the first package was the result of a negotiation. It was not a reflection of the depth of the need for investment.
Congresswoman Katie Porter says if child care centers begin to close, it'll have a devastating effect on the economy. She says workers in every industry rely on child care.
Making sure that we have quality and affordable child care is really a massive investment in our economy.
And as states lift their stay-at-home orders, millions of American workers with children at home are going to have to go back to work soon.
I don't see how we can restart our economy unless we've got child care facilities open.
Democrat Mike Levin says many child care facilities have been unable to get emergency government loans and might close if Congress doesn't act.
Specific funding is absolutely necessary.
The Democrats in the House are going to come with a great big wish list of all the other stuff they've ever hoped for, then that's going to be a bill that fails pretty fast.
But Republican Doug LaMalfa doesn't think a $50 billion investment in child care belongs in a coronavirus relief package.
The focus of all these bills at least stayed in the ballpark of addressing the disaster.
House Democrats say child care is a huge issue and will be, even after the coronavirus crisis passes. In Washington, I'm Joe Khalil.
Recently, the Centers for Medicare and Medicaid Services made changes to its policies to help Medicare recipients during the pandemic. But lawmakers worry those changes will go away at the end of all of this. Washington correspondent Basil John reports on what lawmakers want to see going forward.
Some members of Congress want Medicare's new access to telehealth to remain even after the pandemic.
It's important that we have more options. I think it's become clear to so many Americans the value of telehealth because of this crisis.
Virginia Representative Abigail Spanberger is co-sponsoring the CONNECT Act to make Medicare reimbursement for telehealth, mental health, and other services permanent.
To ensure that Medicare patients have the same access to the same sort of options that VA patients may have or those who have private insurers may have.
The bill also removes current restrictions on services received inside a patient's home.
And that's pretty much defeats the purpose of having telehealth services available if one cannot use them from one's home.
Spanberger is not alone, with representatives on the other side of the aisle recognizing the need to guarantee telehealth for the long term.
I think we do need to lean into this effort to reduce and remove unnecessary regulations, especially those that get in the way of seniors accessing health care.
Virginia Representative Ben Klein says seniors in rural areas are especially at risk.
Telemedicine is the future of healthcare in rural areas where we not only struggle to provide the needed services, but also struggle to attract providers to this area.
Klein says broadband expansion will also make Medicare services more accessible for seniors now and in the future. Reporting in Washington, I'm Basil John.
Coming up, businesses are reopening and more people are out and about. Our panel weighs in on the first week of the transition when we return.
You're watching Inside Utah Politics.
Time now to dig deeper into some of the big stories of the week with the Inside Utah Politics panel. This week we have State Representative Carol Spackman Moss and former State Representative Holly Richardson. Great to have both of you with us. Thanks for being here in this post-COVID-19 era on Zoom.
Thank you. It's a pleasure to be with you virtually.
Yeah. Yep. Glad to have both of you here all the time as well. Okay, let's get right into this. Some big questions are starting to arise about no bid contract spending in the state's response to COVID-19. State Auditor John Dougal has confirmed with me he's looking into somewhere around 50 million purchases or maybe even more. He cannot confirm that all of those are no bid, but says most of them likely are. Representative Spackman Moss, let's start with you on this one. Your thoughts on the state response, in particular when we're talking about emergency spending.
Well, I think they need to answer a lot of questions, both to the public and to legislators like myself and many others, because we're being told all the time about the necessity to be frugal now, and we're probably going to have to cut budgets. And then the public reads about this, and people contacted me over that hydroxychloroquine buy, and it's just become a huge issue, and it's contrary to everything we hear typically from legislators, particularly Republican legislators. And I think transparency and accountability are the two most important values that we have to show to taxpayers.
We'll get deeper into both transparency and accountability in a minute, but Holly, let's go ahead and bring in your thoughts on the emergency spending efforts we have seen from the state to this point.
Well, I think first we have to acknowledge that elected officials are in a really difficult position. And it's not just the elected officials, right? But everybody working on this. Things are happening so quickly, and there's all kinds of information that's coming out and coming so rapidly that I think they're in a darned if you do and darned if you don't position, because if you don't respond quickly enough, then you're going to have a bunch of people mad at you. And if you respond quickly, then you have potential problems like we see come up right now. But at the same time, right, you have people who say, and you see it right with the opening a little bit more of the state, people are like, okay, you're not the boss of me, right? And that there's other people who are like, look, our rate is still going up. So yes, I'm absolutely for accountability and transparency. I always have been. But I also think that people who have been leading this response are doing really some heavy lifting under really incredibly difficult circumstances and trying to do the best that they can. So I'm going to give them a little bit of grace.
Okay, Representative Spackman-Moss, I want you to go ahead and weigh in on that factor, because that's what they will argue. Look, we have to act, and we have to act fast. So your thoughts on that?
Okay, well, I can give some of them a pass, but not all of them, because a lot of these expenditures were driven by politicians, not by public health officials. And that huge buy of hydroxychloroquine and the attempt to put in a $6 million, $8 million stockpile, when that drug had not been proven. And as we're seeing all the emails revealed, people are saying things like in government are saying, well, we have to bend the rules. Well, to me, bending the rules is equivalent to, sometimes it's equivalent to breaking the law. And there are a lot of friendships and charges of cronyism that look like it was driven as much by politics as it was sound medical science. And that's the thing that concerns me. Friend of a friend of a friend got the state to buy millions of dollars worth of something. Those are the things that don't pass the smell test. And that's what we're asking about. That's what Democrats are asking about. That's what the public is asking us about.
Holly, address those specifics right there, because we have seen some situations, especially the hydroxychloroquine purchase, where even the governor and others have said, okay, this was a mistake, we shouldn't have done it. And you can start to put this line together of the same people that are ending up with these multi-million-dollar no-bid contracts. So address that specifically.
Yeah, I mean, I do think that we need to be careful and perhaps more careful. But again, I think we're caught in this bind, right? It's not just the state of Utah that said, hey, we think this malaria med might be helpful, right? When we first started seeing this internationally, right, with people in Italy who were saying, hey, in France, we think that there's something here. We think that people are getting better on this. And then all of a sudden that translated from, we see a few people to, oh my gosh, let's everybody do it. And I think we've learned in Utah that was a little too fast. We jumped too fast. But I think that it's important to try and weigh how long does it take to go through an RFP process. And I don't like no bid contracts. I don't think they're smart at all. But can you do it in a more rapid manner, right? How do you make the decision between this is going to be the wonder drug and this is totally unproven medically, right? I mean, I think there's this line.
So Representative Spackman-Moss, when you talk about accountability, who's accountable in these situations in your mind?
Well, I'd say start with the governor and then Lieutenant Governor Cox, who's the head of the task force. But when these decisions were actually overriding good sound science. And if you read the Deseret News article about the emails, Dr. Angela Dunn was at odds with that use or proposed use of it. And who was the person in the United States that was touting that drug first? President Trump.
True.
Not a doctor. And so when the medical experts and epidemiologists of the U are saying, no, this drug is not even close to being tested enough for its efficacy, not to mention the kind of side effects that are associated with it. My pharmacist calling me and telling me, he's on the state pharmacy board, there is zero reason that any pharmacists need additional supplies of this. We have plenty. So that part of it doesn't say transparency and accountability in my opinion.
Holly, one last thought on this issue before we move on to another one. Both the lieutenant governor and the governor, when asked about this, said we didn't know about it. We've seen emails come forth since then that maybe question, they were on the thread and they probably should have known about it. Was that an answer that was acceptable to you when we're talking specifically about this drug purpose, that we didn't know about it?
Yeah, and here's why, because I know even in my time in the legislature, sometimes there are things that come so fast and furious that you think you know, but you don't really know. And it may be that they were looking at a different area. I do know that the Governor's Office of Management and Budget, the GOMB, was really involved in some of these decisions. And it may have been that they just said, okay, look, we trust you guys, go and do it. I don't know for sure. But I do think that there's a little bit of grace, I think, that needs to be allowed in this situation. And look, everybody's doing the best that they can, and they're trying to walk this line between keeping people safe and maybe, like Representative Moss said, pharmacists did not see shortages, but who could have guessed, I know I couldn't, that we were going to have shortages of toilet paper. I mean, I just didn't foresee that. And now we have shortages of meat. So it could have been that they were looking down the road and saying, what if the supply chain is broken?
Okay, we have about a minute left, but I want to give each of you 30 seconds to share your thoughts on the transition into moderate risks. We've now seen businesses reopen, more people out and about. How's the process going from your perspective? Representative Speckman-Moss, let's start with you. 30 seconds.
I think it's mixed. I'm seeing a lot on this Nextdoor app in my area, the argument with masks or not masks. My husband and I went to Costco the other day. Everybody's wearing masks. It worked very well. I'm hearing at some of the other local places like a meat market in Holiday that some customers are very angry about it. I mean, just to protect other people. It just seems like the considerate thing to do.
Okay.
But I do see a lot more people gathering together, close together, teenagers and others. So it is a concern.
All right, Holly, the final 30 seconds are yours. Your thoughts on what you're seeing.
I don't think it's going well, not in Utah County. I think people said, okay, we have sheltered in place for long enough and we are done. And so I go to stores. I'm one of the only people wearing a mask. I had a friend who drove up the canyon over the weekend and it was absolutely jam-packed, not one iota of social distancing. So we'll see what happens in a couple of weeks, but I'm not so sure it's going that great.
Really great conversation. Both of you, appreciate having you with us. Thanks so much.
Thank you very much.
We'll be right back with more Inside Utah Politics right after the break. Stay with us. We leave you now with a look at what's on the radar in the world of politics. The primary election is coming up next month, and it will be conducted mostly by mail due to the coronavirus. Watch for ballots to start arriving at your home the week of June 9th. The voter registration deadline is June 19th, and Election Day is Tuesday, June 30th. Make sure to connect with me on social media. I'd like to know what you think of this show and other issues that are important to you. You can email me at InsideUtahPolitics@abc4.com, or you can follow me on Twitter and Facebook. Just log on and search Glenn Mills, ABC4. Thanks so much for making us part of your day. We hope to see you again next week as we go inside Utah politics.